Hi there, welcome back to my YouTube channel, and today we are going to talk about bones of skull. Skull is composed of several separate bones united at immobile joints called sutures. The connective tissue between the bones is called sutural ligament, and the mandible is only exception to this rule, as it is united to skull by mobile joint, that is temporomandibular joint. If we talk about skull bones, they are made up of external and internal tables of compact bones separated by a layer of spongy bone that is called as gyploid. The internal table is thinner and more brittle than the external table, and the bones are covered on outer and inner surface with periosteum. Skull is made up of 22 different bones that are 8 cranial bone and 14 facial bone and 6 ear bones. The bones of skull can be divided into those of the cranium and those of the face. Talking about the bones of the cranium consists of the following bones, one or two of which are paired: frontal bone, that is single; parietal bone, that is paired; occipital bone, that is single; temporal bone, that is paired; sphenoid bone, that is single; and ethmoid bone, that is single. So parietal bone and temporal bone are paired bones of cranium. Talking about the frontal bone, this bone forms the interior part of roof of cranium. It is articulated with the parietal bone by coronal suture, and other than parietal bone, it is articulated with the nasal bone, zygomatic bone, and sphenoid bone. It forms roofs of orbital cavity. Then we have the second cranium bone, that is parietal bone, that is paired bone. It forms the superior and lateral part of neurocranium. It is paired bone. Both bones are joined together by sagittal suture in the midline. In front, it is articulated with the frontal bone at coronal suture, and in back, it is articulated with the occipital bone by lambdoid suture. Inferiorly, it is articulated with the temporal bone, and anterior-inferiorly, it articulates with sphenoid bone, an important joint called pterion. Then we have another cranial bone, that is occipital bone, and this bone forms the posterior and inferior part of neurocranium. Interiorly, it articulates with the parietal bone at lambdoid suture. Then we have temporal bone that has squamous part. This is the flat part that is large and forms the side of skull, and then also have mastoid process, that is bony projection behind the ear that contains ear cells, mastoid ear cells basically, and attaches to the muscles. Then it also has zygomatic process that extend forward to connect with the cheekbone, forming part of zygomatic arch. Then it has external acoustic meatus, that is the ear canal opening leading to an eardrum and middle ear. It also has another part that is called a styloid process, that is a slender pointed piece that serves as an attachment point for muscles and ligaments of the tongue and neck. It also has petrous part that houses the structure of inner ear, including the cochlea and semicircular canal, which are crucial for hearing and balance. Then we have next cranial bone, that is sphenoid bone, that is single bone. It has following part: the body of sphenoid, that is the central part of the bone housing the sphenoidal sinuses, and it has a greater wing that extend laterally from the bone and contribute to the formation of base of skull and the size of skull and the floor and the walls of the orbit. Then it also has lesser wing that are small thin projection that form part of the roof of anterior cranial fossa and contribute to the formation of orbits. Then it also has another part that is called sella turcica, that is basically a saddle-shaped depression on the superior surface of the body of sphenoid, and that houses the pituitary gland. Then is another cranial bone, that is ethmoid bone. It has a scribiform plate, a horizontal plate that forms the roof of the nasal cavity and has a small hole that are called foramina, through which the olfactory nerve passes from the nasal cavity to the brain. Then it has another part that is called its perpendicular plate, that is a vertical plate that forms the upper part of nasal septum, dividing the nasal cavity into right and left halves. Then it has another part that is crista galli, that is vertical projection above the cribriform plate that serves as an attachment point for the palliae cerebri, that is a membrane that separates two hemispheres of the brain. Then coming towards the facial bone, as we know there are 14 facial bones and 2 of which bones are singles. Zygomatic bone, that is paired; maxillary bone, that is paired; nasal bone paired; lacrimal bone paired; vomer is a single bone in facial bone; palatine bone paired; inferior conchae paired; and mandible is a single bone. So there are two paired bone in the cranial bones and two single bone in the facial bone, and the single bone in the facial bone are vomer and mandible. Talking about the zygomatic bone has following part: body, that is the central part of the bone that contributes to prominence of cheek. Then it has frontal process that extend upward to connect with the frontal base, forming part of the lateral wall of the orbit. Then it has temporal process that extend backward to connect with the zygomatic process of temporal bone, forming the zygomatic arch. Then it has maxillary process that extend downward to connect with the maxilla, forming part of the floor and lateral walls of orbit. Then it has orbital surface that is basically forms a part of the floor and lateral wall of the orbit, providing structural support and protection for the eye. Then comes the maxilla that has the frontal process that extend upward to articulate with the frontal bone, forming part of the lateral boundary of nasal cavity. Then it also has zygomatic process that extend laterally to connect with the zygomatic bone, and also has palatine process that extend horizontally to form the anterior 3/4 of the hard palate, separating the oral and nasal cavities. Then it also has alveolar process that basically contains socket for the upper teeth. Then talking about the nasal bones, is a pair bone. Nasal bones are paired, which one are located on each side of midline, meeting in the middle to form the bridge of the nose. Talking about its articulation, it articulates with the facial bone, maxilla, ethmoid bone, and nasal cartilage. Now let's talk about the lacrimal bone. Lacrimal bone is smallest bone of facial skeleton. It almost is the size of fingernail. It helps in process of lacrimation. Now talking about the vomer bone, it is situated in the midline of the nasal cavity below the ethmoid bone and above the hard palate. Talking about its articulation, it articulates with the sphenoid bone, ethmoid bone, and palatine bone and maxilla. Now talking about the palatine bone, it is a horizontal plate. It has a horizontal plate that is the part that forms the posterior portion of hard palate, separating the nasal cavity from the other oral cavity. Then it also has vertical plate. This is the part that extends upward from the horizontal plane and forms the part of lateral wall of nasal cavity and the floor of orbit. Then it has greater and lesser palatine foramina in it, that is opening in the horizontal plate that allow the passage of the greater and lesser palatine nerves and blood vessels to oral cavity. Then we are talking about inferior concave. Basically, it is curved shaped bone that increases the surface area of the nasal cavity, and it's located in the lower part of nasal cavity, one on each side attached to the lateral walls. Talking about mandible, it has parts that are body, that is horizontal curved portion that forms the lower jawline and holds the lower teeth in the alveolar process. Then it has ramus, that is vertical part of the mandible that extend upward from the body. Each side has a ramus. Then it has a coronoid process, that is a thin triangular projection on the interior part of ramus, and condylar process, that is a rounded projection on the posterior part of ramus. So this was all about bones of skull. If you liked our video, don't forget to like, share, subscribe, and comment. Thank you for watching.